just across the road here, so it's quite nice to be back. I have been back occasionally since then. So I've been given a brief to talk to you about some of the methods that we use to investigate the association between exposure to air pollution and to health. And in this talk, that's predominantly what I'm going to do. It's really a sort of introductory talk about the methodology, and then I guess I've got a talk tomorrow. I'm really doing this in two parts. Tomorrow I will move on to talk a bit about how we use those methods to set the air quality standards and what the limitations of the methods are and their application to air quality standards. And then finally I'll get to what I think you probably really want to hear, which is how can we approach the investigation of air pollution source problems, such as coal mining or a port facility or wood smoke heaters or whatever. But I'm going to go through the first two before then, and today will be just the first point. How do we investigate the association between exposure to air pollutants and health? Well, the first point to start with is that we need to, is with the basic point that disease is called, what we're investigating is the relationship. Did they just go down or were they not up before? Right. They're onto it. Okay. Well, it would be easier if I had this. I might just wait for a moment while I see if the frequency certainly. I haven't pressed anything, it's not my fault. I don't think. Yeah, I'll try that. We'll start from this point. So, the basic principle is that we're looking at the relationship between an exposure, and it can be any sort of exposure. In this case, we're talking about air pollution, but it could be diet, it could be occupation, it could be radiation or anything. An exposure and the cause and disease. So in this particular case, I'll just give this as an example. This is a photograph from the report that was published last Friday of the area in the Upper Hunter Valley. And I show it just to illustrate one of the problems in working out what the exposure is. Within this area, there are people who are exposed to open cast mines, and within those mines to diesel equipment, to blasting, to digging equipment. And there are people exposed to power stations, which are within the area, and to various forms of transport, trucks, trains, cars, to domestic wood smoke, and also, of course, to pollutants that are blown in from outside the area. We live in an atmosphere, and the atmosphere is essentially continually mixing. Things are being added to it, and things are being blown in from the outside. So what is exposure can be a very difficult thing to define, and it really, in many ways, is the nub of the problem and the difficulty in doing studies to examine the relationship between air pollution and health. We live in an environment where we're exposed to indoor sources, to industry sources, to cars, and to smoke haze. So one way of trying to deconstruct that problem, one way that we have of trying to make this a tractable or a solvable problem is to decompose the sources into the pollutants that they emit, and to examine the relationship, instead of examining the relationship between the source, for example the mine or the port or the cars, and disease, to examine the relationship between specific pollutants and the disease. Of course, this depends on having good information about the relationship between the source and the pollutants. And we've heard this morning about one of the approaches to looking at the relationship between sources and pollutants, and that's pollutant inventories. But the other approach, which is the source apportionment work, which you heard about last Friday, and we'll hear at this seminar from Mark Hibbert tomorrow. But that becomes critical when one wants to make inferences about the effect of sources on disease from information about pollutants. If we collect information about the relationship between pollution and disease, and we want to decide how that affects how we should control sources of pollution, we need to know very well what are the main sources of those pollutants. But pollutants themselves are fairly complex. You heard a bit about this from Jeff earlier, but what's in the air is a very complex mix of, basically, we try to simplify this problem a bit by dividing the things that are in the air into particles and gases. And amongst the particles, they're a very heterogeneous mix of things. They vary a lot in size, as we heard earlier, from small particles to large particles, and I'll show you a slide a bit about that next. But not only do they vary enormously in size, but of course they vary hugely in composition. They can actually be liquid particles, aerosols or vapours, or they can be solid, and they can be comprised of inorganic materials or organic materials. And at the moment, most of our methods for studying the effect of particles in the air take no notice of the differences in composition. There has been some work that's been done, which we'll hear about the effects of specific types of particles, for example, diesel exhaust particles, but by and large, most of the information that we have from epidemiological studies is about particles as a whole. And we have to say, although this may not always be the state of knowledge, at present the state of knowledge would be that, as far as we know, the particles of a given size have the same effect no matter what their composition. In fact, that's unlikely to be really true, but we don't know anything that allows us to move away from that statement. So there's particles, and there are gases, things that are in gas phase, and Jeff has already told you a bit about the main gases that are in the atmosphere that we're concerned about and the sources of them. This is a diagram that I think Craig got from Wikipedia, and I borrowed it from Craig. But there are a number of these diagrams around which try to illustrate why the size of the particles is important. Actually, the respiratory system is a very effective has a very effective filtering device. It starts with the nose, which is an effective filter for large particles. And it also is lined by a epithelium or lining cells, which have little hair-like structures on them, and mucus, which is very effective at clearing out particles that deposit in there. That's how we put together. And so we do have good filters and removal systems, But particles smaller than about 10 microns actually get into the lower respiratory tract down here. Here's the windpipe, trachea, and they get down into the windpipe and into the lungs themselves. And the smaller the particles are, the airways are like a tree essentially, with the leaves of the tree being the branches getting successively narrower and narrower, and ending in alveoli or air sacs. And only the very smallest particles can actually make it right down to the alveoli, which is the part of the lung which is in contact with the circulation, and it's the part of the lung where gas exchange occurs, where oxygen and carbon dioxide are exchanged. But importantly for the health effects, it's also, as I say, the part of the lung where the atmosphere, where the air comes into contact with closely into contact with the circulation. So that's why it's the particles, the very fine particles that get right down into the air sacs in the lung, the alveoli, that are most likely to have effects on gas exchange and also on systemic, most likely to have effects on the rest of the body by their contact with the circulation. So, I've talked to you about how what's in the air is highly heterogeneous, both in composition and size, but it's also very heterogeneous or variable. By heterogeneous I mean variable over time. The levels of pollutants vary over time, over very short time intervals in fact, and in fact I think it was Jeff who showed you, it was Howard who showed you the slide from up in the Upper Hunter Valley from Campbell, I think, a 24-hour snapshot of variation of fine and coarse particulate levels, and showing that over the course of a 24-hour period there's huge variation in pollutant levels. And this is data from the same source that he got the data from, but this is over a 2-year period from July 2011 to May 2013 of PM10 concentrations in this case at 3 monitors, Musselbrook, Singleton and Campbell, and showing huge variation in this case from day to day, daily average pollutant concentrations. So pollutant concentrations are highly variable, and when you get something that's highly variable like that, it's quite hard to know how to quantify it. Do we quantify it as a long-term average? Do we quantify it as peaks? Is it the highest level that's important? And if it is the peaks that are important, peaks over what sort of period? Is it a 24-hour peak, or a 1-hour peak, or even a shorter period? Maybe even a few seconds of a very high concentration is enough to cause harm. So this time variability also makes it difficult to know how to quantify the nature of the exposure. And then the next thing is who is exposed. For many things that we deal with in epidemiology, it's not difficult to know who is exposed. If we're looking at occupational exposures, then we ask people what work they do. If we're looking at dietary exposures, we ask people what foods they eat. But if we look at air pollution exposures, it doesn't make much sense to ask people what air they breathe, because we all breathe the same air. So that is one of the other key elements of the problem of studying the health effects of air pollution. What are people actually exposed to? What really matters is what an individual inhales. But it's very difficult to measure what an individual inhales because people move through their environment all the time. They're moving indoors and outdoors. They're moving from home to work. They may go away for holidays. They travel. They're in public transport or in cars. So people are moving through their environment all the time. And even if their environment is staying still, which it isn't, the environment is changing, but they're moving. So their individual exposures vary. And you can see the sorts of equipment that's required. The sorts of equipment that's required to measure the sort of complex mix of pollutants that are in the atmosphere with the time resolution over short periods of time that's required is not the sort of things that we can kit our individuals with. This would be a bit hard to carry on your back to measure your daily personal exposure levels. They're big. So we are left with having to measure usually pollution at one particular point and draw inferences from what a single point in space exposure measurements are to all of the people who surround that. And you can imagine that that's a very rough estimate, in fact, of what the actual personal exposures of people living in the area are. This is an attempt that we made, and others have done similar things. This is from a study that we did in Lane Cove area of Sydney, where we measured one particular pollutant, nitrogen dioxide. These are passage samplers for nitrogen dioxide. And this is an area of about 20 square kilometres, where we put out 40 of these passage samplers, and we measured the average nitrogen dioxide concentration at each of these 40 sites. And then by looking at the characteristics, the land use characteristics, the traffic, the proximity to roads, and all the other predictors of nitrogen dioxide at each of these sites, we were able to construct an equation, a prediction, that allowed us to predict reasonably accurately what the nitrogen dioxide concentration would be at any particular point within this whole purple area. And that allowed us to draw a much more accurate and precise estimate about what the nitrogen dioxide exposure was for individuals. The best way to do it, of course, is to get people to carry a personal sampler around with them, to actually wear a personal sampler, and wherever they go, it goes, and so it continuously monitors the air that they're breathing. And this is a little device, commercial device, that measures fine particles, actually very ultrafine particles, and you can wear it for 24 hours, and it tracks the GPS device where you are, and it's fantastic for these sort of studies. The problem is it costs something like $20,000, so you can't do it on a particularly large scale. It's not the sort of thing one can do on a very large scale, so it's limited. So in the end, most of our studies are done based on, we need to make assumptions about exposure based on the ambient measurements, that is the measurements that are done using